Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, June the 28th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday at 3 o'clock, we'll be providing a written briefing with key information on the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. And we'll start today by an update on our vaccine progress over this last very hot weekend. As of today, 78.1% of all adults in British Columbia have received their first dose, and 76.8% of everyone 12 and over has now received their first vaccine dose. We've delivered 4,886,709 doses of all three of our vaccines here in BC, and of those, 1,320,194 are now second doses. This weekend, we did experience some disruption at some of our clinics as a result of the extreme heat conditions, and I know a number of the clinics had to be moved so we could protect the workers from the heat and the people who are coming into the clinic, and I know a number of people had to be rebooked. But despite the challenge, over 95% of all the appointments were completed as scheduled on the weekend, and I know our teams are working very as fast as they can to try and rebook and make sure people are able to access vaccine as soon as possible. And as a matter of fact, last week was it was our highest week yet, where we delivered over 427,000 doses of vaccines across the province. And I just want to express my gratitude and thanks for all of our teams working at clinics across BC. And to thank everyone, I had the opportunity of visiting clinics in Kelowna and Prince George, and just to the amazing work that's being done across the province. So thank you for that. In terms of the number of cases that we've had here in British Columbia over the last 3 periods, from Friday to Saturday, we had 57 new cases. Saturday to Sunday, an additional 50 new people diagnosed with COVID-19. And in the last 24 hours, 38 new cases across the province. So that is 145 new cases across BC. Our total, however, is only up 130 or so. There was a bit of a data correction that had overcounted some cases. So our total number of people diagnosed with COVID-19 is 147,549 in British Columbia. Of the new cases, 48 were in Vancouver Coastal Health Region, 68 were people who live in the Fraser Health Region, 1 was a case on Vancouver Island, and 26 were in Interior Health. We currently have 930 active cases, 107 of whom are in hospital, 37 in critical care or ICU, and 144,848 people have recovered from COVID-19. Sadly, over this weekend, we have had 5 additional people who have died from COVID-19 in British Columbia, bringing that total to 1,754 people that we've lost. One of the people who passed away this past weekend was a person in their 20s. One was a person in their 60s, and 3 were seniors in their 70s. And our condolences go to all of those who have lost loved ones through this time. Our thoughts are with you, even as we are moving through this pandemic phase. We have 1 new outbreak to report as well at Surrey Memorial Hospital, leaving us with 3 active outbreaks in long-term care and assisted living and 2 in acute care. I now want to give an update on some of the data that we've been following so closely over the last number of months. As we are looking to hopefully go later where we've been and how we are, what we're looking like going forward. So this is This is the geographic distribution of cases by local health area, by the residents of cases from the week in May, a month ago, to what we're seeing today, or in this past week. And it's really gratifying to see not only light color yellow in many, many places in the province, but that white, which indicates that in many communities across BC, there were no cases in the past week. And that shows us that transmission has decreased. And we see particularly in the Lower Mainland, where we've had high rates of cases for many, many months, they have now dropped dramatically. And there's a few small areas where there are still clusters of cases, again, related to pockets where there has still lower immunization rates in many cases. If we look at our dot plots that we've been following by local health area, CHSA, it helps us get an understanding of where transmission is happening, and this is case counts. And we can see that Surrey still remains the top of our case count. However, when we look at the scale on the left-hand side, not only has it decreased, but about the last time we presented, a little under a month ago, the scale was up in the 300s per day, and per week, and we're now down at 70 cases per week, being the highest in the Surrey area. And as you can see, the light color of the blue dots across the board, reflecting the protection that we're getting from immunization and the decreased transmission in communities. And this remains the same if we look at the rates of cases per 100,000 population by local health area. It's really gratifying to see all of the local health areas in the Fraser Health region are now down amongst the lowest. And we have a few small areas where cases have popped up. And we know that in Invermere, for example, or Windermere, case rates can go up with very small numbers in small populations, and this reflects a cluster in that community that is now being managed by public health. So this overall is our epidemic curve showing the daily cases on the top line and the dramatic fall that we have seen in cases as we started to get a critical mass of immunizations in the population across BC. And lagging that, but also decreasing, is hospitalizations. And another thing that is important when we look at this is the deaths that we've seen in British Columbia. We had that increase with the second wave, but the fact that it has stayed low despite the increasing cases that we saw during our third wave reflects the ongoing and durable protection from immunization, and particularly the protection that we see in long-term care and our seniors and elders who we prioritize for protection with vaccines. And this is something that we look at carefully. We've been watching the vaccine effectiveness over time, and I have some more data on that to see if we see a waning of protection. And the good news is we're not seeing that. That tells us that even with a single dose of vaccine, we're seeing strong, long-lasting protection from severe illness and, importantly, from death. And we see this across the board. This is the epidemic curve by local health, by regional health authority, and it really shows the picture of slightly different experiences of the pandemic across the province, with the Lower Mainland having the highest peaks, of course, but having sustained high levels of transmission in the north for many, many months starting in December, and really that dramatic decrease once community immunization started in earnest in the north. So really gratifying to see that decrease across the board in all health authorities. And we see the same thing with age groups. The bottom purple line, again, reflects the power of the vaccines that we have, where people over age 80, in that purple line, had sustained low rates of disease even when we were at the peak of the third wave. And we see progressively the age groups coming down as vaccination spread. This is looking at our test positivity rate across the province and our testing rate, and what we can see is the testing rates still remain high across the province, but the percent positivity has dropped, and it's even lower today than it has been up until the end of last week. But it is a reflection again of the decreasing risk of transmission in community. We do know, however, that by age, older people still bear the brunt of the severe illness and deaths. And we see this in hospitalization, which has come down, but still is highest in people who are older, and same with people who have died from COVID-19. One of the things that we've been watching very carefully to see if we are at that place where we can move on, and of course where we have seen resurgences of disease in other countries, and certainly the UK, where we've seen increase again in transmission, particularly in people who are non-immunized, is looking at our variants of concern. And as we can see across the board, the variants of concern make up about 80%, the vast majority of our cases across the province in all health authorities. So we know that once people, that these strains are more transmissible, but we also can see that despite the fact that these more transmissible strains are causing illness, the measures that we have taken, both immunization and also good public health follow-up, that bread and butter work that we do in public health every day, means that case numbers have come down regardless of what strain of the virus people are infected with. And that's going to be important for us as we go through the summer and into the fall, making sure that we continue to have those good, strong, basic public health programs to manage cases and to prevent transmission from growing. We also can see that even with the newer strains that are more transmissible, we're not getting those widespread explosive outbreaks that we saw even a few months ago. So that is good news for us. What we have seen is that there has been a slight change in the proportion of different variants that are causing illness here in BC. And this is, they all add up to 100%, but we can see for the last week, we continue to have the majority of the cases that we're seeing infected with the alpha strain, which is the one that was primarily detected in the UK, and also the P1 or the gamma strain variant, which is about 40% of the cases that we're seeing. The Delta has bounced around a little bit. It's now about 12% last week, but we have to remember that's a much smaller number than it was even a few weeks ago. So we are seeing good protection and good decrease in transmission from the actions that we're taking through public health and through immunization again. In terms of our immunization progress, this is our population pyramid on the left, which shows you by age group, people who have received first doses and second doses in green. And it really is remarkable how people across the province in all age groups have stepped up to be immunized. And we know that second doses are now increasing as well. So we're at, as of when this slide was made last week, end of last week, we're about 76% with dose 1 and over 25% of people have received dose 2. We do see some variation by health authority, where we're more challenged in some communities, particularly across the north, which is a huge geographic area with many small communities, getting out there and getting people immunized, making sure they have access to vaccine in a way that's convenient for people. And we're seeing lots of new strategies across the north and interior in particular, but across the province to make sure people have access to vaccine when they're ready. This shows the same information by the trajectory of how we were able to provide immunization by age group. And as you can see, for every age group, it goes up rapidly. But as younger people were immunized, that leveled off a little sooner in each successive age groups. We're now at the point where we're starting to see a little bit of leveling off in the 12 to 19-year-olds. And so now's the time to focus our attention on making sure as we go into summer, we're protecting young people so that they can take full advantage of the opportunities for the summer and are protected going back to school in the fall. If we look geographically, We are seeing this is vaccine coverage in 12 and up. We see that it is high across the board. The lowest, the lightest color green reflects at least 50% of people 12 and up being immunized with dose 1. And we can see there are still some pockets where we have work to do, but it's very gratifying to see over 80% in many areas of the province. And I know we're working hard to get everybody up there too. And if we look again at the local health area with people age 50 and over, that's even more positive, where we're above 80% in many parts of the province, particularly in the lower mainland, some of the areas where we've had that most dramatic impact of the virus in communities. We have been watching carefully around breakthrough cases, and these are challenging to measure. But as more people are immunized, the number of people who are infected, who are vaccinated, is likely to go up because most people who have been exposed to the virus will have been immunized, and it's not 100% protective in everybody. So we have seen about a 2% rate of breakthrough infection over time, but still the risk in people who are immunized is dramatically lower than the rate in those who are non-vaccinated. And this is reflected in this slide, where we see as the rates are coming down across the board, they are considerably lower in people who are immunized than non-immunized. This is a little bit more complicated, but it shows the same thing. By breaking down the rates of infection by the different variants. As you know, we're doing whole genome sequencing on all cases now, so we have a good sense of what strains of the virus are circulating. And for all of the strains that we see circulating in BC, the rate of infection in people who've been immunized is much, much smaller than those who have not yet been immunized. And what we are moving to is a better way of understanding the protective effect of immunization in the population. And we presented, prior to moving to step 2, this same vaccine effectiveness data for people who are 70 and over. And we are now at the point where we can measure that same thing in people in the 50 to 69 year age group. And this is using a very sophisticated test negative design that was developed by the BC CDC, especially Dr. Skowronski, over the last number of years to look at influenza. And we now have the ability with the team at BC CDC to look at how well these vaccines are protecting us on a real-world basis here in BC, despite the different variants that are circulating during this period of time. And you can see the breakdown on the people, about 60,000 people that we were able to link their immunization status and case status and look at how well the vaccine is protecting. And what this shows us is that immunization is preventing 7 out of 10 infections across the province. So we have overall a 70% vaccine effectiveness. And this is really good news. It tells us that these vaccines are working in all age groups, and we have the information from the 70 and over a longer period of time that protection is lasting and is durable. I also wanted to, this is a slide that shows an update of the seroprevalence studies that we've been doing since the very beginning. And we've done these, and this is now the 5th sample that we've taken. It's a cross-section of people in the community to look at different age groups to look for antibodies for the virus. And early on, we had less than 1% of people who had antibodies to to SARS-CoV in March of 2020. And this remained relatively stable through to September. It increased a little bit in the study that we did in January of 2021. It went up to about just under 5% of people had antibodies. And now what we're seeing, so we can measure antibodies that are protective from immunization and also from infection. And we can tease those apart, and that work is still ongoing. But these are the preliminary results from the study that was done, the seroprevalence samples that were taken in June, that show that now about 50% of the population in BC at different age groups have antibodies to this virus. And the vast majority of them are protective through immunization. So this is a really great way of measuring, helping us understand the level of protection in the population through antibody levels. So where does this leave us now? We'll go back to our modeling that we've been using as a guide, as a way of trying to understand the types of infectious contacts we've been having and what we call the reproductive rate over time. And what we can see is we now have a sustained low reproductive rate. That means that for most people who are infected, they are not passing this virus on to anybody else. And that's how the pandemic will fizzle out over time, as long as we continue to not have infectious contacts, to do the things that we need to do to prevent transmission. And it really reflects, I was talking with my colleagues in the north and the interior, when we have clusters of cases now, instead of that being spread widely, it is people who we are known contacts of cases. So when they become infected, they're already being isolated. So in that way, they no longer pass it on to anyone else. And that's how we come out of this pandemic. And if we look at the modeling that shows the potential that could happen as we continue to increase our social contacts, as we return to those things that we need so much, whether it's work or the social interactions that we've been missing for so long, we will expect to see some cases again, and some clusters, and some transmission in certain situations. But it's not likely that we're going to see that rapid increase in spread in the community the way we did even in March. And that's because we know we have a solid base of protection through immunization, and we have a strong public health program to follow up in each of the cases and clusters as they occur. So this is where we are now and what we're looking at to make those determinations of how we can move into step 3 later this week. So we do need to remember that this is predicated on us doing everything we can to get immunization as high as it can be, and our case rates as low as possible. And that is what is going to get us through this summer and allow us to get our lives and back and to have those connections that we need. It's also what is important for us to have ongoing protection, because there are still unknowns about what's going to happen as we move into the fall. So we'll need to continue to watch carefully. But we know that these vaccines are providing incredibly good protection. And to make this a summer we all can enjoy, we need to make sure that as many people as possible are protected, and then we'll monitor to make sure that this protection is long-lasting. So I encourage everyone to start the summer off right. Ensure your children are vaccinated when they're eligible before you take your summer holidays. And if you're going to be traveling, encourage and help family members near and far to do the same. And book your second appointment when you're eligible. Our progress through this pandemic has been here in BC the result of us all working together against a common foe, supporting each other with compassion, even as things changed, even as sometimes it was unclear what was going to happen next. And we learned a lot as we went through this last 18 months. But we have and continue to have to do our part to get through this extremely challenging time and put the pandemic behind us for good. We need to know that this virus is going to be here, but it's not going to be in a way that's disrupting our lives like it has for the last 18 months. And as we bridge to these brighter days of summer, let's make this a summer of hope and rejuvenation for all of us. We need to continue to get our vaccines to make sure that we're best protected, both for ourselves, for our family, and for our communities, and continue to use our layers of protection in those times when it's risky. I also want to just make a few notes about, we know how challenging it is in these last few days with the extremely hot weather across the province right now. And Importantly, from a health perspective, the temperatures are staying high at night. That means we don't get that reprieve, and indoor air temperatures increase during the day, and particularly in places that don't have air conditioning. So it's like this, conditions like this that make people most at risk. So even when temperatures come down, hopefully on Tuesday and Wednesday this week, they will still be high and people will still be affected by them. If you don't have air conditioning, close your windows in the morning before the temperature outside gets hotter than the temperature inside. That helps keep the cooler air inside. Close your blinds as well, and curtains and shutters to keep the sun out. Open windows at night when the temperature outside gets cooler than the temperature inside. And things like pointing fans outside the window. Also important to drink plenty of fluids, to wear light-colored clothing, to not go out and exercise and work in the heat of the day, and to take care of yourself and look in on your neighbors and those around you. We've shown through this pandemic that we care about our communities and the people that are in our communities, and this is an important time as well to check on those who are not as mobile, who are elderly, to make sure that they have access to water, to make sure that they can cool themselves down with a cool face cloth and things like that. I know that this has been just another challenge that we are dealing with, but we can come together and support each other through this as well. And let's also, of course, remember to be kind, to be calm, and to be safe. Thank you.
Thank you, Dr. Henry, and I wanted to start by expressing my condolences at a very difficult time to the families, the friends, the caregivers of the 5 people who passed away in British Columbia this weekend related to COVID-19, 2 from Friday to Saturday, 2 from Saturday to Sunday, 1 in the last 24 hours, 2 in Fraser Health, 2 in Interior Health, 1 in Northern Health, as Dr. Henry has said, 1 in their 20s. This is, at this point in the pandemic, and yes, we are making progress, but COVID-19 continues to make people ill, and in this case, lead to the most serious illness possible. We want to let everyone know that we're with them in this moment, this difficult moment to grieve, and we're thinking of them today. I wanted to note as well that this weekend was extremely challenging for many healthcare staff in BC. Emergency health services, our ambulance paramedics saw 2 consecutive days with record call volumes on Friday with 1,833 dispatches and on Saturday with 1,850 dispatches. The previous all-time highs were January 1st, 2017, which was 1,833 dispatches, in other words, the same as Friday, and January 1st, 2018 with 1,819 dispatches. This is reflects, of course, why over the last couple of years and now we're giving so many resources, unprecedented resources to the ambulance service, but it also reflects the challenge we have and why in this time when people are able to do some of the things they haven't done, and we're dealing with still with 2 public health emergencies, and our healthcare staff, especially and including our ambulance paramedics, have been working flat out under very challenging conditions throughout the pandemic. We have to, I think, recognize their heroism and give them all of the support we can possibly give them. I think the heroic work on the weekend extends, of course, beyond first responders to everyone in the community and in acute care. And as we saw health authorities move vaccine clinics to new locations, add air conditioning where possible, and rebook thousands of appointments, it was important to ensure that people attending vaccine clinics can stay safe and are able to easily rebook or drop in at nearby clinics. As soon as decisions were made to close or move clinics, people with booked appointments were made aware of their options by text message or email. The health authorities and the immunization staff did an excellent job at mitigating the effects of this hot weather, and were still able to get vaccines administered Friday, Saturday, and Sunday to 183,160 people. For anyone who had the clinic they were booked at canceled or moved, we will get you rebooked and vaccinated as soon as possible We are working to improve safety in your local clinic, and when that isn't possible, we are making additional spaces available at other clinics. But I want to thank everybody involved this weekend, including those getting vaccinations, those whose plans may have been changed somewhat. But the fact is, and you see this in the overall numbers, 78.1% of adults, 76.8% of all those over 12, 30.5% of received their first dose, 30.5% of adults have received their second dose, 28.5% of all those over 12. These are significant achievements of the largest mass immunization program in the province's history, and I thank everyone who's experienced and gone to our vaccine clinics around BC. Certainly many who've been in contact with me express their appreciation to the staff, to the teams, to the volunteers, people who've joined us from the travel industry and from the airline industry. People, of course, our care workers and healthcare professionals are appreciative of all their work, and I certainly am as well. I wanted to say finally that from Dr. Henry's presentation, from our case numbers, and from our transition into summer, it's a hopeful time for us all when we've earned by registering for, booking, and getting our first doses, and when we are invited to do so, our second doses, and when we've made possible by following the guidance we've been given to keep safe, and by adhering to the orders that stop the spread. In the days, weeks, and months ahead, we need to remember this. Unless we're told otherwise, whether our summer adventures and activities see us stay local or travel to BC places we've not seen in a while, we must make sure we carry our COVID skills with us every time we go out the door. Our COVID skills keep us safe, keep us healthy, and save lives. Continuing to do what we know is right, what's required of us, and what's asked of us will make for a summer that restores our spirit. I'll make one final appeal to anyone who hasn't registered for the vaccine. The opportunities across BC in big communities and small communities to drop in and get your dose 1 vaccination are there, and we need everybody to step up for themselves, for their families, for the ones they love, and for their communities. And when we get an invitation to book our dose 2, to book as soon as possible and to get that as well. If we do this together, it makes, as the data shows, as the evidence shows, everything possible. It is something, a pure gift we can give ourselves and we can give our communities. And I invite everyone who has not done that so already to please register and get vaccinated for their first dose of a COVID-19 vaccine as soon as possible. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. Il y a eu 5 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 5 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 57 nouveaux cas. Pour la deuxième période de référence, nous avons eu 50 nouveaux cas. Au cours des dernières 24 heures, 38 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 107 personnes sont actuellement hospitalisées, dont 37 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. For the first question, we go to Shannon Patterson, CTV.
Oh, hi, Dr. Henry and Minister Dix. Can you just very briefly tell me a little bit more about the person in their 20s who died? What health region, pre-existing conditions, were they unvaccinated? And does the data that you just gave tell us phase 3 is happening? It's a go. On Thursday, we can expect everything that was outlined in that plan to happen.
In terms of the second question, we'll have an announcement about that very soon. So, things are looking really good in terms of going to step 3. I don't have additional information right now on the young person who died this weekend. It was in Interior Health, but I don't have any additional information at the moment.
Shannon, do you have a follow-up?
Part of phase 3, maybe a part that some people are questioning, is the removal of the mandatory mask mandate for indoors. I know it will still be recommended, but it will not be mandatory. Can you explain why you think that's a good idea to basically make it sort of more of an honor system that people should do it rather than mandate that they have to?
Yeah, absolutely. And this is something around masks that you will recall is something that we in public health have worked on for a long time. And it really is, we're at the point where risk in our community is changing dramatically, and particularly for people who are immunized. And so it is, in many ways, an incentive for people who have been immunized, have received 2 doses of vaccine, that masks are no longer that last line of defense that you need because your risk has changed so much. So we are moving from a period where orders were required to, because we had a lot of transmission in our community and every single layer of protection was incredibly important. Now, as we have protection through immunization and we have decreasing transmission rates, it's really important for us to give that agency back to people. And you wear a mask based on your own risk and based on being immunized and protected, where you protect others through being immunized as well. So we are at the point where I believe it's important that we take away orders as soon as we can and that we take what we call the least restrictive means. And so we'll be moving to guidance again around where it is important, where are the conditions that it's important for people to continue to wear masks, to have all of those layers of protection, and where, if you're immunized, you may not need to rely on that last layer of protection anymore.
Next question, we go to Richard Zussman, Global News.
Dr. Henry, the modeling shows that the Delta variant continues to grow. Yes, you acknowledged it's a smaller number because we don't have as many cases, but are you legitimately concerned that we could get to that point that's shown in the modeling where we're at 80% of contacts and 50% of Delta, and we start seeing those cases climb again? Like, is this how transmissible we believe this Delta variant is?
Yeah, so we've been watching that really closely, and we see there's a whole bunch of different factors that go into it. And I think we have to, and I've said this a number of times, these variants aren't little spaceships out there on their own. They're strains of virus that are infecting people. And we know that the same measures that we take to prevent transmission works no matter which strain of the virus you're infected with. What we have is a much lower margin of error for the variants that spread more quickly. And yes, some of the data from the UK shows that it is more transmissible, but the jury's out on that a little bit. But where we are seeing the transmission happen is in pockets of unvaccinated people. And we saw that in the UK, mostly younger people, which means we're not seeing the same impact on hospitalizations. And if we go back to our goals of the pandemic, it's to reduce morbidity and mortality, particularly serious illness, and to make sure our healthcare system's not being overwhelmed. And we have to balance that with the impacts on society. So absolutely we will be watching, and that's why we do whole genome sequencing on every strain of the virus that we're seeing, because it is likely, given transmission in other countries, and as we start being more mobile, there'll be other strains that come in, whether they arise here or whether they arise in another country and are imported here. So the same things that we do to control the alpha, the gamma, the delta, and whatever new one arises will work. And we've seen that. We've seen that because our cases have come down regardless of which strain people are infected with. And we had an outbreak in a long-term care home with the Delta variant, and it was controlled, and it's now over. So we know that the measures work, and it does involve, we also know that immunization works to protect against all of the strains that we're seeing here. And we're seeing that in the UK, for example, where immunization reduces your risk no matter what strain of the virus you're exposed to. So those are the things that we need to keep working on, watching carefully what strains are circulating, and having our strong public health programs on the ground, which we are committed to continuing to do.
Richard, do you have a follow-up?
We saw the new WorkSafe guidance today towards a move to communicable disease plans rather than COVID-19 safety plans. We're anticipating this could happen on July 1st. Are we at the point now where there is an equal or lesser risk of COVID-19 than there are other communicable diseases in our community? Like, are we at the point now where we should be taking measures to protect us and less focused on, this virus that we have been heavily focused on now for 16 months?
I wouldn't put it exactly that way. It's not that it's less risk now than other communicable diseases. It really is that the risk has gone down because of immunization. But we've also learned that in many, many workplaces, there are some things that we should be doing regularly that we want to keep up. And it helps us puts us in good stead as we move into this fall, because there are still unknowns about what's going to happen when we have respiratory season, when we know there's going to be more influenza, there's going to be RSV. We don't know what the influenza season is going to look like this year, as it was non-existent last year. And part of the reason why we didn't see influenza was some of the measures we were taking. So it is really moving from very specific COVID safety plans based on that virus and where we were seeing transmission to looking at how do we have general principles to keep people from being infected with other communicable diseases as well, that will carry us over through whatever season and whatever comes up next. So we see things in certain workplaces where influenza gets transmitted, or norovirus can cause outbreaks in schools and workplaces. So these are all basic principles that help protect people from communicable diseases no matter what they are. And that's how we're moving with WorkSafe, and we're working with them around how do we put these plans into operation so that we can be prepared for whatever comes up next, and particularly to keep us prepared for the fall as well. So it is, I think, a really great move to having general principles that make workplaces safer for everybody. There are some workplaces that we've identified that are higher risk for transmission of infections, and that was really exposed during this pandemic, where it's important that people have the agency to stay home if they're sick. And, that part of that is having paid sick leave. We also know that the barriers can be very helpful in some situations, and some of them will remain. And certainly in many workplaces, barriers will be in place for this next few weeks, because we aren't yet at the place where the transmission is low enough and second doses are high enough. So those are all the things that we're working with different sectors and WorkSafe BC to get these general principles in place to protect us all.
Next question, we go to Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thank you for taking my question. You mentioned briefly vaccine breakthroughs being at 2%. Would you be able to elaborate on how much of that is people who've received their second doses? Like, how many people have died after getting fully immunized? Like, can you break down those numbers? Because it seems to be something that a lot of people are wondering about, is just how safe everybody is if there are still people dying after getting a second dose.
There are indeed people dying after getting a second dose. It's a very small number. I believe it was 9 that we've had so far. So the rate of infection, the proportion of cases that are people at least 7 days post-dose 2 is about 0.2%, and it's about 2% for people 21 days after dose 1. And I recall there's 65 people who have died after having dose 1. So this is how we translate that into protection from the vaccine, is the vaccine effectiveness, because it's a matter of risk over time. So it's a complicated process, and it's hard for me to explain. But the bottom line is what we showed here, that your risk goes down by about 80% for once you've been immunized with at least a single dose, and goes down even more after your second dose. So while we may see more numbers of people who are vaccinated now that a higher proportion of the population is vaccinated, the risk for an individual and across the population goes down dramatically. And I'm not being very articulate about that, but we are working on some descriptions that we can put out on the BC CDC website to help explain that better than I'm doing right now.
Marcella, do you have a follow-up?
Yes, and just to be clear, has anybody died in British Columbia after receiving their second dose?
Yes, there were 9 cases of people who died after dose 2.
For the next question, to Moira Whiten, the Tyee.
Hi, Dr. Henry. Thanks for taking my question. With us in a good place to move to stage 3 and Alberta essentially lifting all of their restrictions later this week as well, are you concerned about interprovincial travel between the two provinces where Alberta has a much lower uptake rate for vaccines, I think in the low 70s right now?
Yeah, and we know there are pockets, and particularly we know there's a lot of travel back and forth between communities on both sides of our border with Alberta. And the most important thing that we have here, because we are going to have more people coming here from other provinces across Canada, and our advice to them is don't come unless you're vaccinated, but we know that there will be travel. And yes, there may be people who bring the virus with them. And that's why it's so important for us to continue to do the things that we're doing, which means high immunization rates here. So even if the virus is introduced, it's not going to spread. And making sure we have the strong public health program in place here to find cases and to stop transmission when they do happen.
Moira, do you have a follow-up?
I do, thank you. Could you speak a little bit more to the specific figures around first and second dose uptake in northern and interior health regions, and just what can be done beyond simply offering and making the vaccine available to promote it in areas where there may be long travel times to vaccination clinics, some vaccine hesitancy or questions, or little access to primary care or primary health care.
Yeah, and I had the privilege of spending some time both in Prince George and then Kelowna last week with the teams that are doing the immunization strategies and the public health follow-up there. And these were the questions that we were talking about, and we had met with community leaders and others to get ideas about how do we reach out to people. And really, the vast majority of people we're able to get through our mass clinics, but also particularly across the north and the interior, where we have many smaller communities, and as you say, where it can be quite a drive. I know people were telling me that there wasn't vaccine appointments in Fort St. John, and they were told to just drive to Terrace. And people not understanding the distance that we have to deal with. So Northern Health and Interior are both looking at how do we bring vaccine to people in a way that's more convenient to them. One of the ones that was really successful was drive-through clinics where people don't have to book appointments and then they can drive through. And I know, unfortunately, a number of those that were planned for this week were postponed because of the heat. Not so much for the people driving, but for the staff where they have to stand outside. So we are looking at all kinds of ways, whether it's through, there's mobile clinics that are now moving through different smaller communities and setting up for a day or two in different communities, and those have worked well. There's been pop-up clinics at farmers markets and other places. So it really is what you say, making it easy for people to get access to vaccine and making it convenient and to get their questions answered as well. And there's a really strong virtual support program for people who have questions. So I encourage anybody to call 811 and they can provide you with some basic information, but also to go to the BC CDC website where there's lots of detailed information about the vaccines as well.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on vaccinations, cases, and hospitalizations, which you can find at news.gov.bc.ca. For the final question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, given that this heat wave is set to continue in BC for several more days, do all vaccine clinic locations now have suitable cooling plans in place, or should we expect to see further cancellations or rescheduling of appointments in the coming days? Might they be moved to other locations? I'm wondering if you can give a bit of a look ahead to what to expect given the weather.
I might defer to the minister on that one as well. There has been there's lots of planning going on, and in some cases the air conditioning has failed at a certain point in time, so they had to, at short notice, move clinics. And we've been trying to do them either early in the morning or later in the evening when it's cooler, and that's not always been in some really hot areas in the lower mainland, particularly in the Fraser Valley areas. That can be a challenge as well. So it is a dynamic situation, but I know Minister Dix has some more information on that.
I think, Tanya, we're going to continue to adjust. You saw in redirecting people at 7 Fraser Health testing centres to new locations that had air conditioning, and those places were not fundamentally changed. Some of our vaccination clinics that are outside have been affected, not just because of those working there, but because we want to be able to keep everyone safe, including those waiting in line for the vaccine. So, for example, in Lake Country, we've brought in air conditioning into a tent for people waiting the vaccine. There's indoor clinic space in Lake Country, but we've brought in air conditioning for others. There have been other changes. We've moved the clinic in Jaffrey today inside. And in a lot of locations, they've been moved. In some specific instance, the clinics are being closed and then people are being rebooked. So we're adapting to the situation, but a weekend where we had 180,000 vaccine doses administered showed that the work at our vaccination clinics continues to be extraordinary. 95% of the appointments fulfilled. Some were deferred, but they were deferred in the interest of the safety of those working there and those receiving the vaccines, and they're being rebooked. We also have increasing capacity over the next week with more Vaccine Now this week in BC. So there will continue to be adjustments in the interest of people's safety and in their health. But I think our teams are doing a very good job, and they're simply adapting to the circumstances. And that may happen in the next day or two as well, in specific locations as well. For example, in Vanderhoof, the clinic has been moved off a few days and is now taking place, rescheduled to July 6th, 7th, and 8th. And all of the detailed information about these changes are available on the websites of the health authorities.
Tanya, do you have a follow-up?
Yes, please, and if we could get an answer from Minister Dix in French as well for my colleagues, thank you. When will the province give data on hospitalizations and deaths in people who have been partly or fully vaccinated, consistently giving that data in order to give confidence in vaccinated people to make decisions and incentives to those who haven't gotten a shot to do so?
We have been reporting on it regularly, but it's, as I was trying to say earlier, it's not just a number. It really has, it's looking at your risk over time, and that's where the vaccine effectiveness is what really tells us that, 7 out of 10 infections were prevented by vaccines. And so on an individual basis, we know that the vaccine gives you a certain level of protection, and that tells us how many infections are prevented because of immunization on the community level as well. So we do have the numbers on hospitalizations, but they don't tell the whole story. And like I say, there's a bit of a paradox that the more people are immunized, the number of people who are immunized who become infected goes up, but the risk of your infection still remains way, way lower if you're immunized than non-immunized. So as I mentioned, we are putting some detailed slides together that will be updated regularly on the BC CDC website, and really moving to having a dynamic vaccine effectiveness out there to show people how well it does at protecting us overall. Sorry.
No. There's, the other thing I would suggest people do en anglais is to talk to people in Prince Rupert and see what happened when we went to an olive community vaccination there, or people in Whistler, an outbreak that was in part fueled by a variant of concern that received a lot of attention, the P1 variant, the Gamma variant, and what happened before vaccination and then after vaccination. And most importantly for me, because this is obviously something that I think about every day and every night, every day when I get up and every night, the impact on long-term care of vaccination, to go from 49 outbreaks to a handful in a short period of time because people, staff, and residents were immunized, shows the effectiveness of those vaccines. So I suggest, if they don't, there's evidence, and the evidence was presented today by Dr. Henry, and there'll be more evidence, but talk to people who live in those communities about vaccines, and I think they'll tell you that it's time to get vaccinated. Je dis en français qu'on va avoir plus de matériaux dans les jours et semaines à suivre pour démontrer avec des chiffres l'efficacité de nos vaccins. Et ces vaccins sont parmi les plus efficaces de l'histoire des vaccins. Et l'effet sur la pandémie de la vaccination est une démonstration de sa efficacité et sa nécessité. Et je veux dire à tout le monde, de s'enregistrer dans notre système, d'être enregistré dans notre système aussitôt que possible, et de procéder avec votre vaccination aussitôt que possible. C'est essentiel pour tout le monde, c'est essentiel pour vous, c'est essentiel pour votre famille, c'est essentiel pour votre communauté, et c'est essentiel pour même tous ceux que vous ne connaissez pas. Être vacciné, c'est essentiel, surtout maintenant. Merci beaucoup. Thank you very much. I'll see you soon.